Dr. Greenberg, I want to thank you again for answering all these questions today. We have one question that, although there's very few people in the study, we run into lots of people that have HPP. What rule of thumb tips and suggestions can you give for the overall health and well-being of anyone with the HPP, regardless of what the severity is?
Well, that's a very good question. As you know, to date, there still is no approved definite treatment or cure for HPP. So all the treatment really has to be symptomatic. What I mean is you treat each symptom as they come up or try to prevent the complications or symptoms that may happen in hypophosphatasia. So as you know, HPP can be diagnosed anywhere on the life cycle, at birth, in infancy, childhood, or even as an adult. And each age of onset is associated with different symptoms. So if you are a baby and been diagnosed with hypophosphatasia, and you have to have kind of expect that this baby needs to have adequate nutrition, so as to meet the recommended nutrient intake for calcium and vitamin D. But at the same time, we know that infants with HPP may have problems with high calcium because of trouble getting calcium into the bones. So a very careful monitoring by the care provider in an infant to make sure that the calcium level doesn't go too high, with working in tandem with a nutritionist or dietitian is really important. So nutrition, I say in infants, and learning how to handle a baby who may be a little bit more fragile is really important. For a child, with early onset of hypophosphatasia in childhood, obviously we know that premature loss of baby teeth is one of the first symptoms. So I think if you have hypophosphatasia or are at risk for hypophosphatasia, good oral hygiene and regular checkups by your dentist is really important. So kind of anticipatory guidance, as we say. We know that children with HPP are at higher risk for premature fusion of the skull bones or craniosynostosis. So parents and health professionals have to monitor for signs of increased intracranial pressure because of premature closure of the skull bones. Now, some babies or children who get premature fusion of the skull bones, they may have an altered shape to their skull, and they may not have any increased pressure, so they may not need surgery, but it needs the follow-up of a neurosurgeon or a health professional experienced in craniosynostosis and an ophthalmologist checking the eye fields to decide whether or not the skull bones that have prematurely fused need to be opened. Children who have hypophosphatasia, we know, have a higher problem with fractures, with rickets, leg conditions, with bowing of legs, and physiotherapy and orthopedic management becomes very important. Again, it's symptomatic, but I think each symptom as treated, whether it be bracing or whether it be nutritional, anything that can minimize the complications of hypophosphatasia would be good. I think as general principles of good health, trying to remain active as possible, treating your children as normal as possible. Don't take them out of activities. Let them function and play to their best capacity, and to be at their side to help them when they need help. But to foster normal independence, normal schooling, and to work to the children's strengths, not to their weaknesses, of course. As adults, one of the main concerns, of course, is pain has been a real feature of some of the adults. So early onset, good management of pain, along with physiotherapy in adults to help prevent arthritis, I think is very, very important. So these are just general good principles of health that everybody should follow, but it's kind of anticipate what complications could arise in HPP and try one's best with one health professional to try to minimize them.